In this morning's Health Watch, our continuing series, Recognizing Alzheimer's. It is a progressive disease that causes physical changes deep inside the brain. But there are also outward signs the disease is taking its toll. Here with a look at the Alzheimer's Association warning signs is our very own Dr. Jennifer Ashton. Good morning.
Good morning, Julie.
What are some of the outward signs?
So there are really three big ones that other people can observe in someone. The first one is losing track of time and place. Now, we all can forget a day once in a while, but we're talking about not knowing what season it is, not remembering what day it is as the day goes on. So that's really a big one. The second one has to do with problems with spatial coordination. So you could look into a mirror, not recognize yourself in the mirror. You can imagine how frightening and upsetting that would be, or have trouble judging distance. And the third one is new problems with words, reading, or writing. So you could look at a clock and call it a hand watch and not be able to get the right word. Again, once in a while in a conversation, we might grasp for a word, but not being able to remember an important word is a key one.
And a simple word, it sounds like.
Absolutely.
That you use every day.
That's right.
All right, what are some of the inward signs? What does a brain look like when someone has Alzheimer's?
So what we're going to see is the difference in a normal brain. You see all these wrinkles on top of the normal brain. It's called the cortex. And as we look closer, you can see on the healthy side that it's really pretty fluffy, and especially this area in the cortex, which is involved in language and reasoning and higher level thoughts. Then when you go to the Alzheimer's brain, you'll notice that there are some changes. It gets shrunken, and you see this is called the ventricle. It gets a little bigger. Down here, you have an area called the hippocampus, which again is very important for new memories and processing memory and recollection, gets a lot bigger. And all of these problems really result in a shrunken brain, and the brain just doesn't function well.
Okay, if you have any of the outward signs that you talked about or the inward signs, what do you do?
The most important thing is if you notice these in someone, get them to a doctor, have them formally evaluated. The earlier you can diagnose Alzheimer's, the faster you can start to intervene, possibly with new treatments, planning your life, and really that is key. This is affecting a lot of people.
Dr. Jennifer Ashton, thank you so much.
You bet, Julie.
To learn more about all 10 warning signs, log on to the Alzheimer's Association website, alz.org/10signs.